And the three presenters today will be Dr. Wall with MCHC out of Chicago. The second presenter is Jonna Moreland with Lakeland College. And then the third one is 21st Century Youth Project, also out of Chicago. And Emil Cambry will be doing this presentation.
All right, so there we go. All right, well, thank you everyone for having me on today. I really appreciate the flexibility that Broadband Illinois has shown with working with everyone's schedule. I know this is stretched out a little bit further than you would have liked. What I'm going to talk about today is the project that is being funded through Partnership for Connected Illinois, and basically it's starting what we would like to start is an Illinois telehealth network. By way of background, this is being housed at Metropolitan Chicago Healthcare Council, which is the Hospital and Healthcare Organization Association for Northeastern Illinois. We have about 94 acute care hospitals within our Collier County region, Cook and Collier County region, which is set up by our bylaws, and we have about 150 hospital and other healthcare organization members in total when looking at it, including associate members that are outside of the Collier County. And what we're starting with is basically a telepsychiatry pilot, and it really is, I think, our first step in trying to develop a Illinois telehealth network. So why telepsychiatry? Currently, right now, within healthcare, there is a burning platform, and that burning platform is behavioral health. There is a scarcity of specialists, specifically psychiatrists, and there is currently a lack of inpatient and outpatient care facilities. And these patients really are very, very complex patients with a high utilization of healthcare resources. When you look at healthcare and the burgeoning costs, about 20% of the patients consume about 60% of all the healthcare dollars. And behavioral health patients, especially those dual diagnosis patients of either psychiatric issues and/or substance abuse, along with complex medical problems such as diabetes, high blood pressure, high cholesterol, really make up a significant portion of this 60%. And part of their care and trying to keep them stabilized is the need for good mental health. And here in Illinois, there is a lack of psychiatrists. And the psychiatrists are located really almost, I don't want to say primarily, but predominantly within urban areas. So they're not necessarily spread out through the population on a population basis. Along with that comes, since 2008, is the downturn in the economy, which has really changed the revenues that the public institutions have to work with. So that overall, in the last 3 years, there's been a 32% reduction in behavioral health funds. And this has led to a closure of mental health facilities, a reduction in the community mental health services, especially those outpatient services. And the impact is that there's now an increased number of behavioral health patients who present to the ED in crisis. And this has really become debilitating for emergency care. If you can imagine, if you have a 16-bed ER and 4 of your beds are taken up by psychiatry patients, you really have 75% of the space to take care of heart attacks, appendicitis, pneumonia, all the other medical and surgical issues that are likely to come to an emergency department. So it really does affect throughput, and if your throughput is affected, then the entire quality of care that's delivered is lessened. So with this impact, there's a 47% increase in the number of behavioral healthcare patients presenting to emergency departments, and we've talked about the impact of that. And really, psychiatrists are not available in the ED setting. They're in their own clinics and offices, occasionally with inpatient consults for those patients who are admitted. And speaking as an emergency physician, we're not always well equipped in terms of the best therapies for patients in distress. Certainly we can sedate them and keep them calm so that they're not a harm to themselves or to the staff, but actually what is the right medication to get them started on, that really does take a special expertise, which is in the field of psychiatry. Also with emergency physicians, there's the potential for unnecessary admissions, as we really don't want to make a mistake, right? We want to be as risk adverse as possible, but physicians with a higher level of care may choose a different disposition, specifically discharge with outpatient follow-up if if it can be arranged. So what's the solution to all this? You know, one of the things that we're looking at really is telepsychiatry, and there is a tremendous amount of interest among the hospitals, especially rural and medium-sized hospitals, non-academic centers, for having a telepsychiatry solution. And what does it need? It needs video equipment, and I put inexpensive up here because it's all relative. Up until about 2 or 3 years ago, the video equipment, it's really almost uniformly video conferencing equipment, and the units, when put onto a cart, could be anywhere from $3,000 to $7,000, starting for basic Cisco, Tandberg, Polycom equipment. But now with the change in technology, really it's possible to outfit a laptop, which the hospital should already have if they have a electronic medical record, with a special camera, special microphone, for about $800, which is significantly less than the $3,000 to $7,000 that would cost initially under old systems. Excuse me. What do we look to do? We look to reduce the length of stay. So, to put it simply, when psychiatric patients show up in the emergency department in distress, and if we're unable to find a place for them to stay, from an inpatient standpoint, their length of stay in the ER, how long they stay in that ER, can be up to 4 days here in Illinois. Actually, up to 8 days if you do, according to certain surveys. So the thought is that if you can actually get them treated on the right medications and have psychiatric telepsych follow-up, they may actually be able to be discharged after a day or two, as opposed to waiting the 4 days for an inpatient admission. So we can reduce inappropriate admissions. There's also a better use of staff. If you think about it, each of these patients, when they're in the ER, they need to have 24/7 sitter or security standby. So the need for security can be reduced. There's also the reduced risk to the staff, especially for those patients who may be violent and need a significant amount of sedation. And then ultimately it also will save the hospitals money by decreasing the admissions and increasing the throughput into their emergency departments. So what does telepsychiatry offer? It offers access to care, because right now there really aren't a lot of psychiatrists who come to emergency departments, especially in central and southern Illinois. Efficiency of care. Ideally, the psychiatrist would be available to come in within an hour or two of the consult, and then appropriate care, giving actually a higher level of specialized care than can be delivered by an emergency physician. So what's our current pilot design? We've chosen a technology put out by Vidyo, V-I-D-Y-O, which uses a hardware router and a software solution at the endpoint, where it's just the originating side of the patient. Our plan is to connect 2 to 4 rural hospital EDs. We plan to have 2 MOUs signed, hopefully by tomorrow or going out tomorrow. And we're looking to attract 2 more rural hospitals. In terms of the provider, when we initially wrote our grant plan to PCI, it was to use an academic medical center here in Illinois. Unfortunately, as we were going through it, the academic center could not meet the 24/7 needs of an emergency department. So we had to go back to ground zero. We reviewed about 25 national models of care. We sent out an RFP to 4 vendors, 2 national companies and 2 Illinois. And we have settled on Insight Telepsychiatry, which after a very rigorous review process, we really do feel that they are the best in class at this moment in time. And they offer 24/7 capability with a 60-minute response time. So from the time when the emergency department would like a consult and they call Insight, Insight will deliver through video a psychiatrist within 60 minutes. So that's what our current pilot is, but we're also working on a lot of the external issues around telemedicine and telehealth. And so some of the external barriers that we've been working on in the last 2 months, 3 months, one is licensing and credentialing of telemedicine providers. The licensing here in Illinois can be very, very difficult, lengthy. It's 2 to 3 months. If you are following the news at all in terms of the lack of funding for the Illinois Department of Professional Regulation and the need to increase the cost of physician licenses, the backup now is at least 6 to 8 months is what the latest statements were out of IDPR. So we have met with Manny Flores, who's the acting secretary of IDPR, to investigate regulation changes of allowing an abbreviated telehealth license. So for those physicians who are not located in Illinois, there'll be a shorter licensing period with a lot of reciprocity back to the state from which they originate. And then we're also have been in discussions with them in terms of what it takes to develop a central verification organization, which really has to do with housing all the credentialing for physicians so that it can be expedited at the hospitals once the decision is made to develop a telehealth program at those hospitals. Another external barrier to sustainability is reimbursement for services. So providers, they may be willing to provide the telehealth services, but they don't really want to do it for free. Medicare will pay for rural consults, but they do not pay for urban consults. Medicaid in Illinois will pay for both. Currently, for private providers, it's kind of a catch-22. If you talk to the providers, they say, we don't pay for telemedicine here in Illinois, but they will also readily admit that no one has submitted any bills to them. So we don't know if they would actually pay or not if a bill was submitted. To date, there are about 16 states that have mandated payment. It's my understanding that there are 8 states which have bills in legislation to mandate payment for private providers for telemedicine consults and services. Illinois is actually one of those 8, and there's been a recent bill placed in the Senate, and we have been in discussions. In fact, I think someone else is talking right now with the Illinois Department of Insurance about a potential House bill to mandate the same here in Illinois. And then the other is really the hospital and provider and awareness of readiness of telepsychiatry. The hospitals do need to have broadband. They have to have a culture of innovation that is ready to accept a new way of business. So here at MCHU, we've partnered with SIU, and Southern Illinois University really is the driver of a telepsychiatry symposium, which is going to be on March 6th, where speakers from all around the nation who are involved in telehealth, telemedicine, telepsychiatry are coming to speak to raise this awareness and really sort of develop that groundswell from the providers to make them understand how this can change their practice and improve the quality of care that they provide to patients with behavioral health issues. And so again, we're using this funding as a pilot project and looking to hopefully develop a telehealth network. Currently, right now, the state of telehealth in Illinois is very fragmented, with each provider bringing their own technology and equipment. So we are going to explore the possibility of having a single platform, or at least connection to hospitals through video, of which the providers then can connect their providers to that platform. And that really allows the IT at the hospitals to concentrate on one connection and one level of interoperability, and it's really up to the providers then to work with video, which is a quickly emerging company which most of the providers already have interoperability with. So some of the services that could potentially be delivered are things like telestroke, telederm. Case management is really an interesting thing in terms of the ACO. That 20% of patients that utilize 60% of the resources really can benefit from case management. Video interpretation services, which would basically be language services and American Sign Language, are other types of services that are already delivered and can be delivered in a more coordinated fashion here in Illinois. And so with that, are there any questions?
Great. We really appreciate the presentation here. Dr. Wall. It's wonderful to hear how this will take shape. And let's go ahead and open it up now to all of our participants. If they have questions, you can either type them in or raise your hand and we'll unmute you so you can go ahead and ask your question here. So let's go back and see if they have any hands that are raised here among our attendees to speak to this great project. Let me go ahead and start, Dr. Wall. Could you just speak a little bit about what you've sort of the next steps? You talked about a couple of different hospitals that you may be working with in other parts of the state. How can those on this call, us at Broadband, Illinois, and others who learn about this project get involved to help you advance your project further?
I think with things like this that are really at their evolving stage, I think that there are a couple things. One is which of the hospitals in your area are interested in these services or in need of these services? Have they thought about them? And then the other is, what are the types of services that they would want? Certainly telepsychiatry is a burning platform. ASL is a huge issue for hospitals. Usually it can take 2, 3, 4 hours to get an interpreter, whereas in a video interpreter it can happen literally within minutes. And it's also a Joint Commission requirement to have these sorts of things. So I think from the people on this call, a lot of it would just be intelligence in terms of what is it that their communities need, but also maybe to get their communities and their hospitals thinking about what it is they can use this technology for in terms of the improvement of the quality of the services that they provide.
Provide a little bit of information about the conference that you have underway on March the 6th. Tell us a little bit about this.
Sure. That is a conference that is being co-sponsored by several different organizations. I think I can come back to there. It's an SIU is in the lead. If you were to go to the SIU website, there should be a link because that is where people can sign up with. I can also send the link out to you if you wish to be able to provide it to other attendees.
Great, thank you.
There's one site that is at UIC. Oh, sorry. There's one site here that's UIC in Illinois, and another site that is at SIU, and they will be teleconferenced together so that both Central and Southern Illinois, as well as Northeastern Illinois, can participate simultaneously.
We'll post that information on the Broadband, Illinois website. We do have a question here from Roger Huff. How will patients be able to continue connecting with the telepsychiatrist?
So that is a great question. Right now, this is set up as an emergency department initiative. 2 of the hospitals that we are working with who are we're sending the MOUs out tomorrow. They actually would like additional cameras to set up into their outpatient clinics, and this really goes back to that dual diagnosis complex issue of having medical care and psychiatric care available in the same place for these complex patients. But the other thing that this can offer is for those patients who are maybe can go home because they've been stabilized with the right medication, but they have to have follow-up the next day. But for some of these institutions, a psychiatrist may not be available for 2 hours away. Follow-up is not an option. So for these hospitals, if we can put these endpoints, basically video endpoints, within the clinics that they already run, they could follow up the next day, every month as needed for the appointments that they would need to keep them stabilized without having to go 2 hours or 3 hours someplace else for specialty care.
All right,
Okay,
well,
great.
go ahead, Ann.
No, thanks, Drew. I know, like I said, I'm working remotely, so I'm not in the same room with Drew and Nathan. So my apologies if we are kind of talking over each other on this. Thank you, Dr. Wall, for your presentation and also for answering the questions. This is a program, I know I say this with all 14, but we are very excited about this. And in fact, Broadband Illinois is actually having a telemedicine summit in late May, and we hope as kind of a solutions panel to really involve Dr. Wall and MCHC and so much of the accomplishments and tasks that they are undertaking with the telepsychiatry. And I really encourage everyone to please go on to the SIU website and register. There is the location in Springfield and one in Chicago. I am going to be in attendance as well as a couple of our other Broadband Illinois team members. I know Dr. Wall had a second engagement, so I will let him go ahead and get off the webinar and move on to his next appointment. If you have any further questions, please, you can keep these on the question server, and then I can put those on our website later on. The second project we will move to is Lakeland College, and that is Jana. I'm not sure, Jana, if you also have Emily or if it's just you, so I don't want to leave one of you out, but Lakeland College is up next, so thank you.
Hello, actually this is Marlene Worth, and I'm the director of this project working with Lakeland College and the East Central Illinois Development Corporation. And Jana Moorcraft is with me today, and we'd like to explain our project. Okay, can everyone see the first screen?
Yes, we can see it.
If everyone can see the screen, can you please go ahead and raise? Perfect, great.
Okay, we'll continue then. Okay, the name of our project is Connecting Generations, and you can see from this screen that the East Central Illinois Development Corporation and Lakeland College have worked to address the broadband needs in East Central Illinois for several years. And our regional broadband action team became Southeast Central E-Team for Partnership for Connected Illinois. As you can see on the screen, its focus was on both broadband, which is the high-speed access, and broadband adoption for our rural region. And we discovered that a one-on-one basis was needed to work with the adults in our area. Focus was both on broadband access and the broadband use for citizens in our rural area. And in the summer of 2012, a pilot project called Connecting Generations in Effingham was developed to be a model for other rural communities. And Connecting Generations grant was then received, and we definitely want to say thank you for that grant. I'm going on to the second slide. Like the pilot program that was at Effingham, Connecting Generations is about matches caring, tech-savvy area students with older adults for a one-on-one personalized instruction on computer and internet-related topics. And actually, it's the seniors who, or any adults that want to learn, choose the topics they want to learn. It's not in a class situation. It's a one-on-one with students who are willing to help the seniors or any adults that want to learn. Okay, the next slide will explain a little bit more of what we're doing. This was a collaborative effort between Lakeland and ECIDC, as I said before, and local U of I extension offices and the Effingham Helen Mathis Library, which was our pilot program, and we call all of us the project partners. To begin with, we held an informational meeting on November the 1st in 2012 with the library directors in our ECIDC Lakeland College district. And of course, this encompasses most of East Central Illinois area. While our goal was to have 10 libraries participate and try to adopt the Connecting Generations program, we actually were able to get 12 libraries that joined us. The project partners are presently working directly with library directors and what we call the community champions. These are people in the community who are willing to work with our project to assist the libraries in, and you can see the bullet areas there, to facilitate community champions meetings and involvement. This would be concerning where seniors would be located, like senior citizens centers, or I know some of them have made contact where they have piecemeals, and we have contacted high schools, especially the ones that have need for service hours for their students. The next bullet says we train interested middle and high school and college student volunteers. These are just some protocol that we expect from our students when they come in to work with the seniors and what they might expect from the senior citizens. We try to match the volunteers with older adults that we see might work the best together. And the last bullet on this screen, we provide a public meeting place for the one-on-one instruction, and most of the time it's been in the public libraries. Going on to the next screen, what are the benefits of our project? Well, the first two concern the older adults, and this is where they learn at their own pace on topics of their choosing, like I described earlier. And the second bullet there, the older adults gain internet skills and confidence. And with it being on one-on-one, they don't seem quite as intimidated as being in a class with maybe some seniors that know more than they do. Now, the benefits for the students. First bullet there, gain valuable and sometimes required community service experience, and that also boosts their resumes. Second bullet for students, make new connections with older generations and also with their public libraries. And overall, the benefits of our project to increase civic collaboration to meet local needs. And the last slide question, where are we right now in this process? Number one, okay, all libraries are at various stages. Most project partners have already met with their libraries and community champions. Some have already started connecting to learn more about the computer. Maybe it's tablets, maybe it's smartphone. We even had a couple senior citizens that wanted to learn how to Skype with their family. Number two, project partners are developing a how-to guide, which would assist in expanding this project to more communities in the future. And number three, we have an external evaluator at Lakeland College who has developed a pre and a post survey to help measure Connecting Generations findings. We thought this would be very, very beneficial in knowing where we are starting with senior citizens and how they feel after they have met with the students and help them with their questions using the computers. And my contact information is there, Marlene Worth, Project Director, and I'm just using my personal email. If you have any questions, please feel free to email me, and we would entertain any questions about our projects at this point.
So those who'd like to ask any questions, please go ahead and raise your hand, or you can go ahead and send questions. We do have some questions here. Let's see. You just go up to this one there. Okay, very good. Could you tell us a little bit about finding students to volunteer?
Okay, I'll let Jonna talk to you about this.
Students can come from anywhere. The Effingham pilot project, they're using middle school students and also some college students through Lakeland College. One of the libraries that I worked with last week, the high school principal was involved, so they are wanting some volunteer hours, especially like the National Honor Society. If their school in general does not have a policy where they need volunteer hours, a lot of the clubs do. So we are working what we call here our community champions. Those are people that are in the community and do have access to students who are interested in volunteer hours. So that has not been difficult. And we also, I'll just throw this in, that we do look for good students. Obviously these students are very tech savvy. But also students are that we don't have good character, that we don't need to worry about, and it just gives them, like Marlene said, just extra hours and something good to put on the resume and just a good thing to do to work with older generations.
Okay, actually we have another attendee with his hand raised. Let's go ahead and recognize Bruce Montgomery. You are now unmuted, Bruce, so go ahead and ask your question.
Okay, I typed in a question. My question is, what are the top internet applications that are currently being supported? Which ones are you providing training on? Which ones are you providing questions and support on their use? And also, is there any training on mobile devices and focus on mobile applications that may be similar to the same ones you're supporting on the internet?
Most of the information that we have used to train our students has come from a website called Net Literacy. That's a whole nother presentation that we could make at this point in time. I'm not sure that we could explain it all, but that is a very, very good site to go to, and that helped us to design our how-to guide for the libraries. Donna, you want to explain the second part? For the libraries.
If you're asking about the, you asking where we get, you might repeat the second question, I'm sorry. Where we get, you might repeat the second question.
Well, I was just wondering, you know, which applications, you know, by name. I'm sure you're probably get a lot of questions about Facebook, and maybe that's one you're using. But I just wanted you to maybe run down the list of the top 5, 6, or 7 or so applications that you focus on. Again, I'm sure email clearly would be one, and searching. But as you get into specific applications.
Okay, sorry, we wouldn't understand your question. I think that depends on the person. If somebody wants to talk with their grandchild and they use Facebook, then obviously that would be, we don't have any particular one that we use. I think if they're asking in general, then Facebook would be one of those. But I think it depends on just whatever that person is interested in.
Okay, and then the second part of that question was because today there is a great similarity of these applications that not only work on the computer and the laptop, but also work on the tablet as well as the smartphone, if you had found yourself engaging and talking about the use of those applications on additional devices like tablets and smartphones, as well as computers.
Yes, absolutely, and I think they've already done some of that work. They would just bring in whatever they have, and you know, most of the times I believe students can help, and if they can't, I'm sure that we would try to make arrangements to find a student who would be able to help them with their, you know, like if they had a tablet and somebody else had an iPad, and if they had difficulty, I'm sure we would find the right student. But it's been a little more, I mean, it seems like we were thinking more beginning computer, but it's really grown to, like Marlene said, Skype and tablet and smartphone even. And so students are really able to help with whatever they have. So, did that answer your question?
Thank you.
Okay.
We have another question here. Jonna and Marlene, could you just speak about some of the other communities that are involved? You've mentioned Effingham and Mattoon, but perhaps you could speak to the 12 libraries that you are serving or plan to serve. Could you just tell us some of the other ones?
Okay, sure. We have Sullivan, Illinois, and the school district there is working very, very closely with this program. In fact, they had formed a technology club at the school, and so this was a real advantage for their public library, because those students in the technology club are the ones that are coming to the public library on Saturday mornings and working with the seniors. Windsor Public Library is in the process. We also have Marshall and Martinsville. We also have, well, we've mentioned Effingham. They were the pilot, but they're also continuing with us. Charleston, Palestine, Robinson, Paris, Chrisman, and Newman, and I believe Tuscola. So we have quite a region here that we're serving.
Excellent. Well, thank you very much for addressing that question. Are there other questions? If so, either raise your hand or go ahead and send it on the chat window. If there aren't any other questions, let's go ahead and move over to the 21st Century Youth Project. And we'll go ahead and pass it to you, Emil Cambry. So go ahead and take it away.
Everyone, I hope all is well. My name is Emil Cambry, and I'm founder of the 21st Century Youth Project. And just to give you a little background on myself, I'm a professor at North Park University, and one of the things that, after the session is done or the semester is over, I have a lot of students that come to me and say, do you know of any jobs? Do you know of any internships? Do you know of any opportunities? And based on the fact that I've spent quite a fair amount of time in the technology space, I know of tons of tech opportunities. I know of different companies that are hiring. And, even today you can read articles talking about the shortage of students, of graduates that are unable to meet the demand of the technology companies that are in fact out there. So in fact, a couple of years ago, started the 21st Century Youth Project as kind of a test. I didn't know if high school students would be interested in learning about web and mobile programming, but we went ahead and just tried to do it and see what could happen. We tested this program with 2 different school districts, the Naperville School District and Crete-Monee, and we wanted to test our model, see exactly where we would be interesting, what the students be interested, what were some of the different models and some of the different things from that. Interesting enough, we found out that our Crete-Monee students were really passionate about our project, and they all released web apps. And to tell you a little bit about our program, we teach the students to create mobile and web applications. They also create a business plan around their application as well. We give them free SAT math instruction, and we also provide them a network of mentors that can talk to them about their careers, whether we've Skyped them in during our sessions, whether we've provided their contact information for them to be able to communicate, and really just trying to make this thing fun. I have a sports background, so all the way in which we try to put this together to make this thing fun is kind of in the many ways in which I've enjoyed sports and growing up in high school actually being heavily involved. So we really try to create it into 3 different categories. One is learn. We understand that it's an after-school program in which we started, and we did realize that some students were going to look at this as an extension of school. So this is why we really wanted to put an emphasis on making this fun as well. and also creating. One of the things that you can see from a lot of the research is that predominantly in underserved communities, we don't necessarily have as many people creating for the different platforms that they consume. So you can see exactly the prevalence of mobile phones and mobile devices in underserved areas, but there's not a direct correlation to the amount of people that are actually creating for those platforms. So we wanted to give these students an opportunity to create, and it's just been a fascinating opportunity to be able to see a student go from not even understanding that they as students can actually be able to create for these platforms to them actually creating and Google searching different other things and ways in which they can add more cool things to their app. So some of the things that we've been able to do in the 2 years we've been running this program, this is our beginning of our third year, it's been easier for us to get a little bit more national attention than local attention, which is why the Illinois Broadband Grant has been phenomenal for us, from being able to open up a lot of doors, give us a lot of validation, and really enable us to continue to move this thing forward in a very, very tangible way. Last year, we won the Edison Award as the most innovative educational program in America, and much of it was based off of our success with our students, the amount of growth that they've been able to have, and some other things of that nature. So I'm just going to toggle ahead. One of the things that we really were taking a look at for just the other countries and that they've said that they've been able to get ahead of us from an educational perspective, we wanted to try to bridge that gap, and we felt that technology was a perfect opportunity. Our students are always playing with their phones, so we wanted them to be able to create for these platforms as well. So one of the interesting things is that the challenges we face, which is why we wanted to apply for this grant, we wanted to create a web platform for students to be able to learn. Because one of the things that we've noticed from being able to implement in the different school districts we've worked with, and in the different charter schools we've worked with as well, there's a big challenge that we face. One of them was scalability. We have a lot of programs and a lot of organizations that want our curriculum as part of their program. And the thing is, we're talking about a highly specialized curriculum, highly specialized type of instructor who can combine what they can do technically, but also being able to explain it as well. And those people are in high demand here in Chicago because, once again, there's a shortage of people that are able to do that. So for us to be able to scale up to multiple different schools and districts and community service organizations was a big challenge for us. One, to be able to find the talent, and two, to be able to implement it on a cost-effective basis. So what we wanted to do with our grant is actually to create this online platform so that, once again, we can use it within our schools themselves, so that, once again, the students can very similar to Khan Academy or Coursera, kind of like the online school explosion that's starting to take shape now. We wanted to provide that opportunity so that, once again, we can implement in the different places a lot easier, cheaper, and quicker than ever before. So one of the things that we were able to do is work with the Firehouse Community Arts Center, which is in the Lawndale community. And one of the interesting things with the Lawndale community is that you were talking about an underserved community in which the tech skills, the creating for mobile applications is just kind of, they're far removed from receiving that sort of instruction. And we wanted to bridge that gap. So here's kind of a picture of the Firehouse. It's actually a converted firehouse that's a community arts center in which over 200 students a day are going to be able to come after school and being able to learn so many things about computer programming. We have music, film. So once again, by being able to have this online platform and being able to implement it, the students could work at their own pace. Because another challenge that we faced was that if you have one or two instructors or three instructors in a classroom of 20 to 25, you have a certain group of, you have a third of the students who excel and they get it, they love it, and they go over and beyond the call of duty. And then you also have a third of the students that are kind of in that medium range. They get it, but maybe not as quickly as the more advanced students. But we also have that third of students that are kind of dragging behind, and we found that they're more likely to quit the program or not necessarily continue because the challenge that they faced was they felt bad that they weren't able to catch up or learn as quickly as the other students. So by having this online platform, having the students that work at their own pace, our instructors become more facilitators in being able to work along with the students and their module-based learning, so that once again they can work at their own pace and being able to understand all the context of what it is that they're learning. But in addition to that, when they leave our classroom and they go home or they go to wherever, they can be able to get that supplemental information, more exercises, more problems, more context, that's going to enable them to either excel even more if they're on that advanced student who really gets it, but also for that student that's dragging behind and may be too scared to ask that question in class, but they have an opportunity to learn as well. So once again, it really enables us to provide a much better environment, and I think with the students, enables them to do more hands-on, project-based learning, works on games, works on all the other things that makes it not just a class, but something that is that they can continue to do as well. And in terms of the Lawndale community, I mean, we're talking about a community that is in need of resources, and by being able to implement this program cheaper, make it easier for us to execute on that, this is just exactly why this project was founded in the first place. Some of the stats were that 67% of Lawndale residents currently drop out of high school, very few have bachelor's degrees, the median income is well below what we think is acceptable. So once again, by having this community arts center, by having this being a pillar of the community that folks in different schools can come to be able to learn and excel and really not have to ask permission for success, they can be able to be integrated in our program. But in addition to that, with the online platform, we can enable all the different other community organizations that shoot us an email. We can say, hey, well, we can be able to implement this much cheaper than ever before. So I guess to talk, here's some of our kids and some of the students that work with us, energetic, excited, and it's just been a great opportunity to work on this project, and this broadband grant has really opened up a tremendous amount of doors for us. So the actual Community Arts Center was going to open up probably around April. It looks like it's delayed more than we had hoped, so it's probably looking like September is when we open up. But I run a technology and entrepreneurship incubator in the Pilsen community, so we've been able to provide a bunch of different programs actually here for those students, so once again we can still be able to deliver the services and the programs and things of that nature. So one of the recent things we were able to do, one, because we had this validation in the local Chicago market, we recently partnered with Groupon and have their engineers perform what we call an open hack here at our tech incubator. So the great thing about the open hack is there's an opportunity for students from anywhere and everywhere to come in during these designated hours, and for the Groupon engineers to work with them and talk with them about what projects that they're working on at their jobs, some of the different cool things that they've built throughout the years. And also it's an opportunity for the engineers to provide one project-based learning experience for the students to work with other students from different communities, different areas, and it's just amazing how coming around a computer screen can be such a leveling opportunity for so many students as well. So we're going to continue that relationship, and we're working with a bunch of other companies as well that are interested now because of what we were able to do with this Open Hack project. And one of the things that we're also going to do, because I have this technology incubator, which is with more adults, we're going to provide internship opportunities for our students so that once again they can work on real-time projects, real-time programs, and once again it gets into job readiness, it gets into learning all these different transferable skills and being able to kind of bridge that gap. Because one of the most important things for me is that I think it makes it much easier for us to say, this is why you need to learn this or why this is important, if you know that, once again, there's a job, there's an opportunity down the road if you learn this stuff as well. And another thing that we've been able to do since then is being able to offer game development, so in terms of computer games. And another aspect of programming, learning these technical skills, being able to create for platforms they consume. But once again, it touches on so many different areas, and once again, that gets the students excited, and that's kind of where we're going to be doing moving forward. So kind of where we are now, is really trying to develop more partners that we can pilot our online platform with. And really being it so that we go from 200 students a day we'll be able to work with to hopefully 2,000 by the end of this year, which is kind of my goal through using this online platform. So I think I've gone way over my time, but I would love to answer any questions that you have about our program. And once again, if you have any additional questions, you want to introduce us to someone that can help us in our mission, our website is 21CYP.com. Thank you.
Emil, thank you so much. There's still have some further time here for questions and answers. Let me go ahead and ask a question. You spoke a little bit about the gaming companies that your trainees are working with, but could you speak about other companies besides those? Just speak to how these skills can be brought into the business and entrepreneurial environments, and maybe any success stories you've encountered along the way.
Yeah, so we're actually just testing that for the first time right now with our different companies. But one of the nice things about this tech incubator, we have 21 companies that are here, and many of them need tech-savvy students to provide value for some of the things that they're doing, but also provide an opportunity for the students to work alongside them. So what we're doing right now is working with a bunch of different organizations to try to figure out what is the ideal model for students to be able to work with adults of different ages and different backgrounds to really add value to the organization so that they don't see them as someone that's kind of in the way, but also being able to add value to their enterprises overall. So that's a lot of the things that I'm testing out kind of for the next 4 weeks and seeing what is the most effective model that we can emulate.
Great, thank you. Are there other? Oh, here's another question. Okay, this is from Bruce Montgomery. What are the top internet app? Oh, actually, this was asked earlier. Sorry, pertaining to the previous presentation. So, are there other questions? Okay, we do have Ernie Sanders. Go ahead and ask your question, Ernie.
Am I muted still or no?
You are now. We can hear you.
Okay, great. Emil, thank you for everything that you just presented on today. You're a bit humble in your presentation, but that just speaks of your character. And I'm wondering if you could talk about how and I heard you, but I don't know if everyone else heard you. But here in Chicago, there's the 1871 model of incubating, and I wondered if you could talk about how your program is similar to that, but yet immensely different because of your constituency.
Oh, absolutely. Thank you for asking that, Ernie. I really appreciate that. 1871 is a tech incubator that's here in Chicago. It's in the River North community, which is one of the more affluent areas of Chicago. We are actually in the Pilsen community, which is important for us because we wanted to be in a community because we realized that for the students that are going to be coming in here, we wanted to have an environment that's welcoming, and everything from the art and the murals that are inside our actual facility is reflective of the neighborhood, and it's something that really resonates with our students. In terms of the actual membership of our incubator, we're actually, we say technology and entrepreneurship, but we have every different type of and form of entrepreneurship, social enterprises, nonprofits, for-profits, some hybrid models as well. So in terms of Cibola, which is our tech incubator, our focus is on diverse backgrounds and diverse interests and diverse people. Once again, we're very inclusive, and for some people that resonates as, oh wow, they're only offering it for a certain amount of people. No, it's not that case at all. We want to just encourage, because we feel like innovation happens when you have different people from different places, different backgrounds, and different interests coming together under one roof and having different conversations. And one of the interesting things is we've been able to have so many different collaborations that have taken place amongst the companies. And the great thing about that is, I think for the students to be able to come in here, and we're predominantly serving a diverse background of students as well, for them to come in our doors and see that there's entrepreneurs that look just like them, talk just like them, have similar backgrounds, similar places in which they're from. We think that that's even a very powerful opportunity. And I think in terms of being able to see that, I know that for myself, I've been fortunate to be a part of different programs that have exposed me to things that I would have otherwise not have had the opportunity to learn about. One was the LEAD program in business, which was a business program where we took MBA type classes, but as high schoolers, and I was in Los Angeles at UCLA. So the 21st Century Youth Project is really very, very similar to that model, except we're just focusing on computer science and technology and now a little game development. So we want our students to see entrepreneurs that look like them. We also want them to add value to these organizations. And I think in this event that we had this past weekend, we had the open hack with the Groupon engineers. We had the students that were there from all across the city, and a lot of students from Chicago Tech Academy. But on the other side of the room, we actually had a hackathon that took place with adults. And one of the things that was just so powerful in terms of our facility is to see the students kind of peek over and see all the adults on the other end who are doing this hackathons and wanting to know what it is, and they're looking at their screens and they're taking breaks from what they're working on with the Groupon employees and just asking, you know, hey, what are you working on, and all of those different things. And then it was just a very dynamic, inspiring experience because you're able to see students who felt very comfortable in this environment, and that's kind of what we're trying to foster here as well. So to answer your question in a very long way, we really wanted diverse people, diverse interests, diverse backgrounds, because you might have students who are interested in fashion, but technology and fashion work together in this fashion, so that's that hook that brings them in there. It might be film, and that's that hook that gets them in there, and then that's why they learn computer programming so they can make an app for the next film. So those are the kind of ways that we're trying to pull students in, instead of not just making it a class in a classroom setting, but make it something where they feel like it is part of their interest and the things that they enjoy learning about and thinking about.
Great, thank you very much. We have another question from Bruce Montgomery. Go ahead, Bruce.
Yes, I have a question. Is there some specific training that is actually going on now? And you pointed to a number of broad areas, entrepreneurship, Ruby on Rails, some different certifications. Is there some focus on some specific certifications that resonate with the current Chicago development community that you think will be a focus of what is actually taught, and there would be a goal of some of these students actually gaining these skills and certifications while they're in high school, giving them great employability opportunities as they continue to stay engaged with this kind of program?
Absolutely, and I think that's a phenomenal question, and that's one of the things that we're trying to work on as well with the certification program. I mean, with our online platform, because once again, I think that we've done well at figuring out the fun aspects of what's going to get them interested. But the next step is to say, okay, we have the fun part, but we have the other thing that's going to give you that long-term job market viability or that job market opportunities that you can be able to pursue. So we're actually working with several vendors right now that are giving us proposals on different things from networking and CCNA licenses, everything from we've been hoping to try to find someone to give us the Microsoft Office certifications and all those other different licenses as well. So the thing that we focused on at first is trying to make this thing fun, and I think we've been doing well at that. The next step is to say, okay, we can make it fun, but we can also kind of give you that aspect that you may not see today as being that important, but tomorrow you're going to be well equipped for. So that's something I'm really spending a lot of time working on as well, and seeing, can we still make that interesting and a little bit more fun the way it currently is being taught.
Great, thank you. Are there any other questions for Neil or for any of the other Illinois Broadband Innovation Fund awardees here. Okay, I don't see any further questions. So we really appreciate the time that you've all given here. Anne, are you still on the line with us?
I am still here, Drew, and I was just going to echo that same thing. This has been such an amazing process through us. It started in July and August with kind of the initial webinars and what we referred to as the tour, and then the announcements came, and we have had some true broadband enthusiasts that have joined us for each of these 4 webinar series. We've had some great presentations, some great questions. We continue to encourage everyone to follow these projects over the next 5 to 6 months. On our communications team, we are traveling from site to site. I know Emil and the 21st Century Youth Project, Nathan and Aaron were there just a couple of weeks ago, and very excited to have their interview and some video up on our website. So we invite people to look at the website. We can have another series at the end of the projects to just kind of show how they were completed through this timeline. But just a huge thank you to the board members that have joined on these calls, again to the participants, and to the projects themselves. So thank you so much, and that's all I had. Drew, if there was anything else you wanted to close out with.
The only other thing I want to say is that as Anne mentioned briefly, all of the information about the projects is online at broadbandillinois.org/innovation. And you can find, again, sort of project information as well as videos that have been prepared about each particular item. So let's go ahead and give appreciation. And I do see a question here from Bruce Montgomery. Are all the PowerPoint presentations posted on the PCI website? Yes, they all are posted, or will be as after today, with regard to these ones here on the Broadband Illinois website. Just go to broadbandillinois.org/innovation, and you'll get to the place where you can see all of the presentations and information about them. So with that, thank you again. We're going to go ahead and conclude our webinar and appreciate the time that each of you have taken. So take care, everybody.